What Would She Do? The show about life, love, and relationships. Hosted by Saran Almond. Changing hearts and minds, one conversation at a time.
According to the most recent data available from the Center for Disease Control, the leading causes of death among women in the United States are heart disease, cancer, and strokes. Today, we're at the Women's Health and Wellness Expo, sponsored by Novant Health at the Levine Senior Center in Matthews, North Carolina. Let's go inside.
Hi, I'm Saran Almond, and this is What Would She Do? Today, we're at the Levine Senior Center in Matthews, North Carolina, and I am speaking with, please introduce yourself.
Hi, I'm Carla Ennis, and I'm the Community Clinical Nurse Educator at Novant Health Matthews Medical Center.
Awesome. Thanks for stopping by to speak with me. So today's event was organized for women's health issues. What made you decide on a gender-specific health and wellness expo?
Well, women commonly put themselves last when it comes to health and taking care of themselves, and they take care of their families, they take care of their husbands, they take care of their parents. And we felt that this was a good time for us to take care of women and make them more aware of issues that they should be looking at, such as breast health and heart health.
I do understand that heart disease is the leading cause of death for women in the United States.
Yes, heart disease kills more women in the United States than all cancers combined.
Okay, so Benjamin Franklin said an ounce of prevention is worth a pound of cure. So when you have events like these and you offer low cost to free health and wellness screenings, is the goal for people to take preventative action when it comes to their health?
Yes, it's very important that women take preventative action when it comes to their health. It's also very important for them to know their baselines when it comes to their mammograms, A1C screenings. We're doing bone density screenings. If they know their baseline, then they can monitor for changes.
What exactly is a baseline?
A baseline is kind of where you are at this point. And that way, if there's changes in your body or changes, let's say in your mammogram, then the radiologist can pick up on these changes and say, you know what, we need to look into this further. So it's always best to be screened early, and then you can monitor things throughout the rest of your life so you know if there's bad changes, and some changes may be okay.
In addition to prevention, it seems that early detection is vital to treatment, recovery, and the likelihood of a cure if one is available. Do you agree with that?
I do. The quicker we can catch something, the sooner we can start treatment and hopefully find a cure.
As we conclude today's interview, what message, feeling, or information would you like people who participated in today's event to leave with?
I think most importantly for us is that we encourage women to be self-managers of their health care.
Is that the same message that you would intend for our viewing audience as well?
Oh yes, it's very important that you don't rely on your husbands or your significant others, that you don't rely on your families or your doctors to manage your health care. You need to take full responsibility for yourself. It's your body, it's your health, and it's your life.
Today we're talking to Dr. Mullins Frazier, Doctor of Osteopathic Medicine and a family physician. Thank you for stopping by and joining me.
Thank you very much.
Well, today you spoke on heart disease, correct?
Yes, ma'am.
And what are the number one indicators that women may be at risk, or what tests should they take to see if they're at risk?
Risk factors for heart disease include genetics. So if you have a family history of heart disease, you are more likely to develop heart disease. If you have high blood pressure, diabetes, cholesterol, if you smoke, or if you have a sedentary lifestyle. in order to check your risk factors for heart disease, you should have fasting lab work just to check your cholesterol, check your blood sugar, and make sure they're okay. And then you should check with your primary care physician when you have this lab work to make sure your blood pressure is okay and you're doing what you need to for diet and exercise to make sure you're living a healthy lifestyle and decreasing your risks.
Now, are there any symptoms for people who, are not aware, they haven't went to any screenings and they just don't know? What are the symptoms?
So if any point in time you develop chest pain, you need to make sure that you see a primary care provider or go to the emergency room for evaluation. Women are more likely to complain of indigestion, upper abdominal pain, back pain, and so in those cases it may be a silent indicator that there's some degree of heart disease.
Oh, wow. So what demographic of women are most at risk for heart disease?
All women are at risk for heart disease. Caucasian women, African American women, Hispanic women. Hispanic women are more likely to do things to change their lifestyle and influence their whole family's aspect of heart disease. African American women tend to think everything's okay, and it's just one of those things that they don't really take time to go to the doctor and get checked out, and the same with Caucasian women.
So for women who are aware that they do have some form of heart disease, are there any activities that they're restricted from, or what lifestyle changes need to be in place for them?
There's not really any restrictions once that you have treatment. Basically just a well-balanced diet, plenty of fruits and vegetables, lean meats, plenty of exercise, 20 to 30 minutes of some sort of aerobic exercise a day to help keep your blood pressure under control, your sugar under control, your cholesterol under control, and reduce the risk factors for recurrence of heart disease.
You are an OBGYN doctor.
Yes, ma'am. That's correct.
Awesome. So we're at the Women's Health and Wellness Expo at the Levine Senior Center, and you spoke on the topic of menopause.
Yes, ma'am. I sure did. It affects a lot of us as we get older. Not any fun.
Well, I know the general idea when you think about menopause is that it happens to older women, and more often it's now starting to happen to younger women. Can you speak to that at all?
Absolutely. So the average age of menopause is 51.4. All those 0.4 people in the world. But that's what the textbooks say. And it's defined by not having a period for an entire year. Okay? So the years before menopause, the premenopausal years, can last anywhere from 1 to almost 5 or 6 years, which is very frustrating and very hard for a lot of women because you have irregular periods. You can have 2 periods a month, skip a couple months, hot flashes, night sweats, vaginal dryness, pain with intercourse, and just feeling blah. Okay. So we're starting to talk about it more as women open up and talk about what's going on. Our grandmothers, they didn't say anything to anybody. They're more private. We, thank God, are more vocal and can talk about these things with our friends and with our doctors. Definitely. So it's not the age changing, it's that we're talking about our symptoms more and they can come earlier. So there's a lot of treatment options we can do for women who both have the premenopausal symptoms and the menopausal symptoms. There's medicines that we can take, hormone replacement therapy, or other medicines that don't have any hormones in them to kind of help with the symptoms. But the important part that I tell everybody is even though this might be normal to have the irregular periods, if you're bleeding super heavy or having more than 2 periods a month, come see me because we need to make sure that nothing else is going on like endometrial cancer or fibroids or something that's dangerous.
Oh, wow, that's great information. So you did mention symptoms. What are the symptoms?
So the main symptoms of menopause are hot flashes and night sweats, just feeling hot from the inside out, burning up. At night, throwing those covers off because you're so hot and then you're freezing. A lot of women have vaginal dryness because as our estrogen levels decrease, The vaginal mucosa, or the lining of the vagina, kind of thins a little bit. So it almost is like sandpaper. So a lot of people complain of that as well. Some people can have some mood swings, and then again, it's the changes of the period of your menses.
So for women who are actually going through menopause and they have, these complaints and all these things going on, what advice would you give to those ladies?
Be vocal about it. Don't keep this inside. This is very normal change, but it's frustrating, and we can do things to help you. And I tell everybody, nobody's a stamp, cookie cutter, oh, you have menopause, you get this prescription. Everybody is different because you have to take into consideration family history, risk of breast cancer or ovarian cancer, and there are other health factors. If you have high blood pressure or diabetes or are, extremely overweight, I'd be more resistant to give you hormones, because anytime we give you any hormones, it can increase your risk of breast cancer or stroke. Okay, or blood clots. But in women without any of those risk factors who are suffering horribly, it's a great treatment option. So you have to individualize all of the treatment.
In closing, what would you like to say to women? What information should they, after watching this show, be aware of that they may not know right now?
Absolutely. I'll tell every woman to take care of yourself. Come see your doctor every year. Even if you don't have a uterus, you don't think anything's wrong, come see us. We need to make sure you don't have cervical cancer. We need to make sure your symptoms are okay, and we're here to help you. Pap smears and pelvic exams are not fun, but they are important. So come see your OBGYN.
Hello and welcome. I'm your host, Saran Almond, and this is What Would She Do? On today's show, we're discussing women's health and wellness, and I have a special guest with me today, Miss Camille DeVoe. How are you?
I'm fine. It's so good to be back.
And we're so glad to have you back.
Thank you.
Now, Camille is a holistic health and wellness coach. And Camille, if you would please share with our audience exactly what that means and what you do.
Okay, absolutely. So I'm a holistic health and wellness coach, and what that means is that I create an environment that will allow you to be balanced with work, with stress, with exercise, and help you to reach your health and wellness goals.
Okay, well that's awesome and right on target for our topic today. As you saw in the video that a couple of months ago, we went to a Women's Health and Wellness Expo at the Levine Senior Center in Matthews, North Carolina. So at that expo, and not just at that expo, but at various expos that I've attended, I've noticed that the participants, the people that go out to these expos, are usually older women. And my thought after making that observation is that maybe women don't address their health needs until they recognize or find out that there is a problem. Is that something that you would agree with?
I would agree with that. Usually people, the doctor is not a place that people want to go. We normally go because we have to get our yearly checkups and things like that, or you're sick. And a lot of times people do not think about it unless something is going on with them, which they should be more in a preventative stage as opposed to waiting until something goes wrong and trying to fix it at that point.
Absolutely. And I think that is health and wellness expos are a great thing for the community because in those scenarios they offer a lot of free screenings that normally, if you were not at that expo, you might have to pay for. So what do you think about, people attending health and wellness expos?
I think health and wellness expos are good. It's a good way to get information about stuff that maybe you didn't know about, different facts, and they give a lot of preventative things that you can do because the prevention part is really important. And so that is what I focus on as well. I mean, everyone has something that they want to work on, but I think the biggest thing is preventative and also the wellness part of it, which a lot of people don't talk about.
Awesome. And I do want to speak to the wellness piece. When I thought about doing a show on women's health and wellness, I thought initially to address the diseases that women in the United States typically die from. So the top 3 diseases are heart disease, strokes, and cancer.
So it seems like the underlying causes of these diseases often have to do with stress. And like you saying, not be able to, when people don't have a good life balance, especially women. That's why we targeted women today. As you heard in one of my previous interviews early in the show, a lot of times women become so consumed with taking care of the house and the family and the work, and they don't take time to address their own needs. What would you have to add to that?
I would say that is correct. Women are a very intricate part of the family. They go to the grocery store, buy the food. I mean, there are sometimes when that is not the case, but generally speaking, they buy the food. So what I like to do is to empower them to buy a better quality of food. If we can get women to be more proactive, and that's more of a preventative thing with the better quality of foods that we eat, it will prevent some chronic diseases from even, manifesting itself into you to have to do something about.
A big concern is it seems to be more expensive to eat healthy than it is to eat junk. Like, I paid $1 and change for an apple, and you could get chips and cookies and a soda for the same money. So, a lot of people are concerned, like they can't afford to buy, a lot of the produce because it's so expensive.
This is how I think about it. Yes, organic food is more expensive. The more that people start to buy in it, as far as they're investing in themselves, the prices will go down. But the other thing that I think that a lot of people don't think about is, what is the cost of cancer these days? What is the cost of heart disease? So when you're factored that in, the preventative may seem now more expensive, but the problem is going to be more expensive in the end.
Speaking to the families who are really, really on a budget, it's not even an option, but they're really down to the wire. What small changes can they make? We have, our elderly who are on very tight budgets. The economy is not so great for everybody. So, a lot of us are having to budget and to try to make $1 out of 15 cents. What are we doing?
You can go to this farmer's market. I like to do that because it's less expensive. Also, you can go to the grocery store and get fresh fruits and vegetables. The thing that you don't want to do is get genetically modified food.
Oh, do speak to that.
Genetically modified is going to be GMOs, and it's basically where they're crossing the food with something else.
So how, as a everyday shopper, how do we know what is GMO and what is not GMO?
Okay. So for produce, it is labeled, and it'll be a 5-digit number that starts with an 8.
Okay.
So organic is a 5-digit number that starts with a 9, and conventional is going to be a 4-digit number. It usually starts with a 3 or 4.
Okay, now break that down.
Okay.
Conventional,
this is for produce, is a 4-digit number that starts with a 3 or 4.
and that means what when you say
Conventional is going to be how they're growing the regular process. Well, it's not really regular, but how they're growing produce now.
Okay.
So there will be pesticides.
Okay, so give that to our viewers one time. 4 digits, start with an 8. Tell us what those numbers
So
are.
let's go with this. It's going to be on the produce, like a little sticker on the produce.
Absolutely.
Like let's say an apple.
Right.
It'll have a 5-digit number that starts with an 8.
So that is
GMO.
5-digit number starts with an 8. That's GMO.
Right. So organic is usually labeled organic. So, but it's a 5-digit number that starts with a 9, and then conventional is 4 digits. 4-digit number that usually starts with a 3 or a 4.
So when it comes to fitness and exercise, what is trending in that area?
I would say HIIT exercise, because aerobics is always there.
Okay.
Weight training is always there, which is good as well, because the more muscle mass you have, the more calories you burn at a resting rate.
What about exercises or routines for people who cannot, engage in really strenuous activities? What is trending for that population?
Yoga. Because yoga is always going to be a good way to work your core,
Okay.
your stretching, your breathing.
So we've talked about, physical health and wellness, and that's inclusive of the diet and exercise. But what about the mental and the emotional health and wellness?
The mental and the emotional is most important, I think.
Okay.
Because if your mind can't conceive it, you're not going to go the next step.
Okay.
So people need to be able to know that they can do it and to see it.
Okay, so the first issue you have addressed as far as taking preventative measures when it comes to your health is improving the quality of your diet.
Mm-hmm.
And so what would be the next thing that women should address when trying to be preventative when it comes to taking care of their health?
Well, with women, everybody's stressed, but with women especially, it is going to be stress because it's not just being a mother in a home, because women now, we do work and we're still mothers. Well, I'm not a mother, but, women are still mothers, and you're doing everything else on top of working. And so if you don't take a time every day to take a breath, to release, find a way to release stress and keep everything balanced, then that's going to be a problem. Because when you get upset, it takes 48 hours for your body to get back to normal.
Oh, wow.
So just think about within that 48 hours, if you get upset again, the cycle starts over, and our bodies are not built to take care of ongoing stress all the time without a break, and different things start happening. And when that happens, that's when we say, okay, maybe I need to go get something checked out.
Okay. So we did hear early in the show that women should, engage, especially if you're a woman who's at risk for heart disease or you're already been diagnosed with some form of heart disease, that they should include 20 to 30 minutes of exercise in their routine daily. How do you coach your clients who say, I just don't have time?
You have to make time, because you're either going to find the time to do that or you're going to find the time to fix it.
Do you find that sedentary lifestyles are more prone to chronic illness and disease?
Not necessarily. It depends on the person. I like to work with my clients is if I can get them to incorporate it into their daily lives, they'll do it. Little things like instead of using the elevator, take the stairs. It's little things. You just need to start getting the body moving. You'll realize that you have more energy.
Okay.
A lot of people don't know that when you work out, your body actually absorbs nutrients better.
Okay.
So it's little things like that.
So what suggestions do you find that people often say, oh, I just can't do that?
It's hard for people, if they don't have an open mind, to change their eating habits.
And how about de-stressing? I hear exercise, I hear diet, but what are we doing in those brief moments where you might be able to take a breath? What does that look like when you want to de-stress?
To take a breath, you can meditate. You can do breathing exercises. You need to be doing something to quiet yourself.
Okay.
Because you can't just keep going busy, busy, busy all the time.
So at the beginning of our conversation, you did mention that you're a holistic wellness coach, and there are still going to be people out there who don't know what the difference is between what you do and practical medicine. Could you make that clear for our audience?
Sure. What holistic means is, one, I'm not going to prescribe any drugs.
Okay.
And what that means is we get to the root of what's going on. And sometimes it has nothing to do with what you're eating. It could be what's eating you. What I have found is that if you're getting to the root of that, and maybe it's something that you knew but you wasn't thinking about it because it's been years ago, and you realize like, I never really thought about it that way, it can change your whole outlook on things and basically change your life, because you're changing, your lifestyle, you're loving yourself more. And when we love ourselves more, we tend to make better choices.
So is the wellness piece of it inclusive of counseling on some level?
It has a little bit of life coaching.
Earlier in the show, we had a segment on menopause. We had a segment on heart disease.
are these issues, even, you know, strokes and cancer and diabetes, are among, you know, other diseases that are, you know, killing women in the United States at an alarming rate. Are these issues that people who come to you are dealing with right now?
It actually is mostly stress.
So how do you get a person, like if I'm at home, or if you're at home and you're so stressed, you know, sometimes stress leads to depression, and you just don't feel like coming out of your bag. How do we get to see you?
Well, you need to know that there is help out there for you, and you know, sometimes it could be just as much as someone listening to what you have to say. Just know that it's very important that if you do need to go see a doctor, to do that. Get tested. If you need to speak to a health and wellness coach, reach out to them. There's a lot of different ways to do that, and it's just the first step, I know, is just like so hard to take, but once you take that first step, the rest of the steps will be so much easier, because we are here to support you, to be your support system, and help you to bring your life back to balance.
With all of that said, what would you like our viewers to leave with? Like, what information do you feel is vital to their health and wellness?
Okay. The information that I think is vital is that you need to know that you have options, and it's as easy as drinking more water is one thing. If you can't do anything else, which we know that you can, but simply drinking more water, some good, fresh, pure water with lemon. Lemon is alkalizing, and that's a good step to start with. Start incorporating more vegetables, fresh or frozen, depending on where you live, into your diet, and just start with that. And, you know, some movement, whether it's stretching, a walk, just little simple things makes a big difference over time.
You often hear people where they'll be in pain, or, you know, suffering, and wishing, you know, that they had done something sooner, you know, rather than later.
You want to know what's going on with you, and one part of health coaching is knowing that you have options.
Okay.
And, you know, some clients, I empower them, go to your doctor, you know, have the test done, talk to your doctor. A lot of people have don't want to talk to the doctor sometimes, and then afterwards they tell all their family members and everything, but when they're in the doctor's office, they're just quiet.
Well, the whole point of this show is to encourage people to take preventative measures to ensure that they get quality health care and maintain their health. If you're healthy, we would like for you to maintain your health. And if you've been diagnosed with an illness, to encourage you to see your doctors. And if you don't have a health and wellness coach, if one is needed, or if that is what you desire, for you to go out and seek the help that you need. So we thank you so much for tuning in today. Thank you so much, Camille, for joining me again.
Thank you for asking me back.
Absolutely. And I'm your host, Saran Almond, and this has been What Would She Do?